Hi, and welcome to The PH. I'm your host, Donnell Christian. On today's episode, we'll discuss aging and COVID-19 and some helpful tips for caregivers and older persons. But first, let's define the basics. Take a look. Aging. The World Health Organization, WHO, explains that aging results from the impact of the accumulation of a wide variety of molecular and cellular damage over time. This leads to a gradual decrease in physical and mental capacity and a growing risk of disease. There is also healthy aging, which the WHO further describes as creating the environments and opportunities that enable people to be and do what they value throughout their lives. This concept is why we have institutions and policies in place to help the elderly cope with various challenges. With that in mind, let us look at the overall impact of the pandemic and how our aging population fits into this picture. According to the WHO, there have been more than 188 million COVID-19 cases globally and in excess of 4 million deaths. However, more than 3 billion vaccine doses have been administered. This stressful setting and the ease of transmission of COVID-19 has created a difficult situation for older adults. In addition, the elderly are also most at risk for serious illness from the virus because of the weakening of their body's defense system based on the natural aging process, lifestyle diseases, and other social and economic factors. The Centers for Disease Control and Prevention, CDC, said, older adults are more likely to get very sick from COVID-19. Getting very sick means that older adults with COVID-19 might need hospitalization, intensive care, or a ventilator to help them breathe, or they might even die. The risk increases for people in their 50s and also further increases in their 60s, 70s, and 80s. People 85 and older are the most likely to get very sick. In the United States, for example, the CDC noted that the rate of death for persons 50 to 64 years old in comparison to those who were 18 to 29 years old is 35 times higher. For persons 65 to 74 years old, 95 times higher. And in the 75 to 84 years age group, the death rate was 230 times higher than the 18 to 29 years old who had the coronavirus. There are also reports of older adults experiencing extreme anxiety during the pandemic based on quarantine measures through lockdowns, job security, loss of relatives, and other stressors. So what strategies can we use to support this vulnerable group? Older adults and their caregivers are encouraged to take various actions to decrease the risk of becoming infected with the COVID-19 virus. This includes physical distancing, washing hands often, getting vaccinated, avoiding travel if necessary, avoiding crowded spaces, and wearing masks. This group is also encouraged to increase activities that will contribute to their overall well-being. This includes having a balanced diet, staying physically active if possible, and embracing telemedicine or other methods to continue receiving health care from their doctors if needed. Mental well-being is also important for the elderly during the pandemic. Johns Hopkins Medicine noted that while physical distancing is critical to preventing coronavirus infections, isolation will only increase negative effects on the body. In a Johns Hopkins University School of Medicine report, one professor said, "Physical distancing doesn't have to mean isolation. We need to keep older adults safe, but also keep in mind that social isolation can have a negative impact on older people's immunity and mental health." From a public health perspective, a major initiative to protect the elderly has been vaccination drives where persons over 60 are prioritized for available vaccines. This is not only based on the group's vulnerability to the virus, but also because elderly homes and retirement villages have had cluster outbreaks in the past year. Older adults in our society need special attention to keep them safe, healthy, and protected from the COVID-19 virus, and there are a number of ways to provide the care they need. Join us as we discuss this further in our interview segment. Today's guest is none other than Professor Denise Eldemire Shearer, Professor of Public Health and Aging at the Mona Aging and Wellness Center. Prof, thanks so much for joining the show.
Thank you very much.
How do social factors affect older adults and their vulnerability to severe illnesses such as COVID-19?
If we are talking about illnesses in general, socioeconomic status can be divided obviously into income as well as to environment. With the chronic diseases, hypertension, diabetes, the socioeconomic status is going to impact access to healthcare. It's going to impact diet. Hypertension, diabetes require dietary management as well as meds. So income can affect that. And it's going to impact on ability to do exercise, the fresh air, and that sort of thing. Environment will be the overcrowding that we can see in larger families in poorer communities. But let us recognize that there's always a positive side, and therefore the support systems of the socioeconomic group and the environment in terms of church, friends, family, are sometimes wider and stronger than in more affluent communities where people tend to live alone or in very small groups.
The CDC says people in their 60s and 50s are at a higher risk of developing severe illness from COVID-19 than people in their 40s and even younger. Can you just give us some insight as to perhaps why?
The vulnerability of older people is from 2 points of view. The immune system is not as efficient the older that you get. And that's why we see the case fatality increasing significantly between, say, the 60-year-olds versus the 80-year-olds. And the case fatality in the 60 to 69 is somewhere double the national, which is almost 2. So you see it at almost 4. But by the time you get into the 80 and over, you're looking at 20% death case fatality. So that's the immune system. The second criteria that increases the vulnerability of older people has to do with the presence of chronic disease. As you get older, the risk factors, the lack of exercise, the poor diet, the obesity increases, and your exposure to it increases. So you could be obese at 30, but you may only have been overweight, obese for 10 years. So the impact on your body is 10 years. By the time you get to 60, that's 30 more years. So there's an impact of 40 years. And so you see more hypertension, 60% of the over 60 population with hypertension, 26% with diabetes. And these are the 2 comorbidities that we are seeing in the death rates or associated with the death of older people, because the issue is not just age, but age plus comorbidity.
In an article last year, you mentioned that 34% of the elderly in Jamaica are anxious because of the pandemic, which is understandable. But how do you think it affects the elderly any differently?
With all that we have heard since we did that research and we interviewed 600 people, I am not sure that it actually affects them differently. I know it has a major impact, but we are hearing all of the problems with young people and children and the lack of going to school and socialization. So I'm not sure it's actually different. The thing about it is that the stay-at-home order, particularly for the 70 and over, while very important and very necessary, we have 18% of our older people living alone. We have another 26% living only with spouses. And most spouses are in the same age group. Therefore, they're staying at home. So the social interaction and the social stimulation for older people is, I think, more than it is for others, because the younger people are going out. We see them out. But I'm not sure anymore. I was then, because it was summer holidays and there wasn't school. But the lack of going to school also now seems to be taking its toll on children, not just here, but abroad. So I think you're seeing it, the impact across the spectrum.
What systems or solutions can the government or institutions in general, can put in place to ensure the safety of the elderly, especially during this time?
I'm glad you mentioned institutions, because That's an area that we're definitely getting reports from. The nursing homes are telling us that they are seeing a lot more patients that used to walk up and down, now staying in their beds, becoming more bedbound. When the stay-at-home was first put in place by various governments, not just Jamaica, the elderly human rights advocates started saying it was ageist, and why were we singling them out? What about freedom? In recent times, there's a lot on television about your First Amendment, Second Amendment rights. It has been interesting to see the shift in the aged care associations, like the one I belong to, the Gerontological Association, and they're now separating population aging from individual aging. And they are accepting that governments, institutions, whether a business place, actually do have a responsibility to protect the population. So yes, the stay-at-home is no longer seen as ageist. So that then puts a responsibility for what we are talking about onto older people themselves and onto their immediate circles, where the family becomes important to have the stimulation to do the various things. I think 10 months is a long time. And whereas families responded very well in the beginning, families also have competing demands. I wouldn't even call them interests. The home school became important. So if I have to be homeschooling somebody and making sure my 5-year-old, my 10-year-old is around the computer, following her class or his class, how do I then have time to sit and talk to grandma, grandpa? So I think competing demands have come in. Many people have lost their jobs because of the shutdowns in various communities. Therefore, our challenge is to make ends meet. And therefore, the issue, we say glibly, families should do it. Families have a responsibility to do it. But we must take into consideration what else families have to do. Churches have been playing a phenomenal role, as they have always done with older people. And churches have set up their WhatsApp groups. They are calling their people, the services online. So I think we need to look to the community groups. If it's even, say, youth groups, do you have some older people that you can speak to? CCRP had put in place a phone line for 80 and over. So I think we have to get creative. It's an opportunity for us to think outside of the box. And of course, for the National Council for Senior Citizens, you have the clubs. The initiative from the Ministry of Health, the Reach Out Rangers, I think is going to be very impactful. We're looking forward to the research, to helping with the research in that area. These Reach Out Rangers, that psychological first aiders, where health centers, private physicians can refer an older person who is lonely, etc., for this person to talk to and to touch base with, all within COVID guidelines. So masking, sanitizing, maybe staying outside the door, etc. But I think these interventions are hopefully going to make an impact.
What are some practical tips that the elderly and their caregivers can actually apply to safeguard against COVID-19?
Let's start with the caregivers, because we often forget them and they are crucial to older people. I think one of the most important things for caregivers is to practice the COVID prevention requirements or suggestions. So the masking, the changing clothes, the sanitizing shoes, the staying as much as possible from the older person, the 6 foot, not always possible if you have to turn them, etc. But I think for the caregiver, the most important thing is so that you have peace of mind, that you are not putting your older responsibility, whether family or paid, at risk. And for the caregiver to recognize that you are playing a critical role in social stimulation. Many caregivers could not go because of lockdowns in communities, etc. And that was stressful for older people. So I think it's for families to recognize that the caregiver is the one constant and to find ways to maintain the caregiver. Public transportation and the fear of public transportation has been a concern. So it's, if there's any other way for the caregiver to come to work, can you pick them up? I know several are picking them up. Can they stay and go home only at weekend? So it's about thinking through the caregiving responsibility and facilitating it as much as possible. For the older persons, and you would also note from that study, older persons actually thought that the restrictions, if we call them that, I call them protections, are actually necessary. It's for them, it's an opportunity for them to learn a new skill, because many of them do have smartphones, many of them do have computers. So it's for the family members to put them on Zoom, to teach them how to talk to grandchildren. I've recently seen on television a program, not sure if we can get it here, but I'm sure that we have enough IT people with skills, where grandparents can play games with children that are not in the same room. It's also about not being afraid. I think for the older people, you don't have to be stoic. We know older people have resilience. They've been through hurricanes, they're the ones that can tell you that they have bounced back. The fact that they have lived to 70 and 80 means they have bounced back. Draw on some of that resilience, but find ways. So how are you communicating? Go out in the yard and talk to the neighbor 6 foot apart. Fresh air is good for you. You can walk up and down. You can get some sunlight and some vitamin D. And to check your diet, and not, if you live alone especially, not to get lax with it and just eat bread and whatever is convenient, but to ensure that you do have some nutritious food. So I think if they look at how to increase their physical activity, walking up and down the driveway, walking around the house, if that's what it is. Now, we do have people in apartments, we do have people in townhouse complex, but 10 o'clock in the morning, most people have gone to work, outside is empty. So pick your times, be safe, wear your masks, sanitize, but don't just sit in a chair and say, we're waiting for this to pass. For some, because we don't want people to feel guilty, and we don't want people to feel that, boy, I'm not doing what I should do. And older people are sensitive. We need to recognize and to give them, to say, look, we know this can happen. Some of the houses, there's a lot of overcrowding. Older people don't have their own room. 5 or 6 children, other relatives. And therefore, to say to them, but if you wear your mask and you sanitize, you are still protecting yourself. You don't want them to give up and say, well, since I can't be in a room by myself, I can't bother. Nothing works as well as the mask and the sanitizing.
Prof, is there anything else you'd like to add or share with our viewers?
My final word is not to listen to all the chatter, the negative chatter about vaccines.
Prof. Shearer, thanks so much for joining the show today and for sharing your insights with us.
Thank you too, and thank you for covering a very, very important topic, 350,000 older people in this country.
To our viewers, thanks so much for watching.
Connect with us. Follow us on Instagram or Facebook at GetThePH.
And to close, we'll leave you with our inspirational quote. Health is a state of complete harmony of the body, mind, and spirit.